So my take-home messages for today are: 1, concussion is treatable. And 2, I think it's really important that we, as the healthcare professionals, give the patients the same message. I think conflicting advice and conflicting ideas as to when they return to play causes more anxiety in the patients, which really does hold them back a bit. So if we can all give the same message and work as a team, I think it gives our patients the best outcome. And I have a really great team of people that work with me. I work with sports physicians, neuro-optometrists, neuropsychologists, ENTs, cardiologists, OTs, vestibular therapists. So we have a really great team that work together to get our players up and running to the quickest that we can. And so it's really important that we work as a team. Okay, and that is my talk for today.
Thank you, Megan. Amazing presentation.
Thank you. Are there any questions?
I've asked people to put the questions in the chat, and I haven't seen any other than a couple of comments just to say how great your presentation is and has been. Megan, I'll start off with a question.
Yes.
I want to put you on the spot. I want to take you back, I don't know what, 10, 15 years? When did you qualify?
Yes. 20 years.
Okay. I want you to imagine that you're an inexperienced physio, or you're working rurally, and you've heard of these, and you're working in sport, and you've heard of these head injuries and concussive issues that you have to deal with. And as a inexperienced young physio, what would you recommend to yourself would be the most important concussive symptoms and signs that you need to watch out for, and then you need to use or manage with your diagnosis and management of the player in the first 24 to 48 hours, and then the following week to 10 days to 14 days. Just the important things. Okay, so
headaches, dizziness, nausea, fogginess. Those would be my brain fog.
I had brain fog a couple of weeks ago. Came back.
Well, I'll tell you, when I was a student at UCT and I was working with the rugby players, there was one guy that was tackled really badly, and I ran onto the field, and I was always told that you must ask them questions. So I asked the guy what was his address, and then I realized he could tell me anything because I had no idea what his address was.
Yes, yeah.
So don't ask that.
And isn't there specificity to the address, to the questions?
Yes, it is. So it has to be short term. It can't be a long term history. Yeah. So it needs to be something like, who was the last player who scored a try? What is the name of your opposition? Who won the first half? Something like that. So you do need to make sure that you understand what's happening in the game, because you do need to know what the answer to that question is.
Exactly. Correct.
Yeah, so it must be short-term recall.
Okay, all right. Okay, and then in terms of the management for 7 to 14 days, you're inexperienced, you've been asked to look after this concussive player, there's possibilities of whiplash, or you have these symptoms that he's experiencing. You know, you're not a vestibular therapist, you're not a psychotherapist, you know, what do you do as an inexperienced physio for the player?
I think the first thing to do is to just tell them that what they're feeling is totally normal, and that there is such good evidence to show that in more than 80% of the time, you will be completely recovered within 10 to 14 days and make a great recovery, and not fill them with fear and being scared that they're going to have long-term damage. I think the important thing is that you really, really hit home that they must do 24 hours of rest. Being on your cell phone for the first 24 hours has shown incredibly to extend your healing period. So my first thing would be 24 hours of complete rest.
Off screens.
Off the cell phone, off screens, off the cell phone. Don't think that message, that meeting tomorrow is that important. It's not. If you just take your 24 hours off completely, you'll make a much better recovery than if you just try to do a little bit and just try to do a little bit. It doesn't help. You just do 24 hours of proper rest. Then from day 2, you can start exercising again, because it's so important to do a bit of exercise. But imagining that you have this metabolism changes in your brain, you need a lot of energy to help with that concussion healing, to try and get that that pump to normalize again. So a small amount of of exercise actually does help with your endorphin release. It helps to bring fresh blood flow to the brain to try and normalize it. But any hardcore exercise is then going to take it away from your brain healing to allow you to perform the activity or to perform the cognitive task or to complete that test. You're going to be using all that energy not to heal your brain. And that's what causes the long-term damage or the long-term recovery.
So hands off, basically. 7
Yeah,
to 10
hands
to
off.
14 days, hands off, encouragement, keep steering them in the correct mental positive kind of direction. Don't try to do too much. Let them recover.
And just sleep.
Yeah.
And sleep as much as you need to. So don't sleep so much in the daytime that it's going to affect your nighttime sleep. But if you need to have a 2-hour sleep in the morning and then another half an hour in the afternoon, that's absolutely fine. Like as long as you've made sure that there is no brain bleed, then you are absolutely fine to let them sleep as much as they like, as long as it doesn't interfere with their night sleeping. Because remember, the brain is healing. The lymphatic system works to detox your brain when you are sleeping.
Yeah. Megan, I see Gracie has turned her camera on and I think she wants to ask a question. Grace, is that right? I'll get you to unmute, Grace.
Thank you, Megan. That was really interesting. I think that element of rest is so critical, and I think that it's really important that you've highlighted that. So yes, thank you very much. And I think Craig, you wanted to come in here. We've had that recent episode in cricket with the concussion too. What was your experience with concussion in cricket?
Gracie, there's two Craigs on this platform. One is a Craig who used to work in cricket 20 years ago.
Both Craigs
and one is a Craig who's currently working in cricket.
Both Craigs are cricketers.
And so since I'm moderating, I'm going to defer to the current Craig.
Craig Govender. Yes, great idea.
Let me find Craig. Craig, can you unmute yourself and come in on that, please? There you are.
How's it, guys?
How's it?
Hi,
I was gonna comment on vegan stuff when I was gonna start, but yeah, concussion is a very important aspect of cricket, most definitely, and it really came about in 2019 World Cup, and unfortunately, I had to deal with that with Hashim Amla and that first game, and the amount of pressure that you on the field is immense, and he actually had symptoms. So symptomatically, he could not continue, and that's the biggest thing around concussion. Any symptom has to be withdrawn. It was a big call. I think I helped a lot of physios in the tournament because all of them phoned me after the game and said, thank you for doing that. But the amount of pressure we got from staff was immense because it was about like the first big thing in cricket at the time. We used baseline testing. So we did a baseline test prior to obviously the World Cup, and then in the change room we did another baseline with SCAT. And then a couple hours later we did another baseline, which another quick test on the computer, which improved, and he went on to bat at 8. And then the next day in the press, we got into trouble. So yeah, it's a tough decision, but yeah, you symptomatically, and 7 to 14 days is where we got to be. Yeah.
Thanks, Craig, for jumping in. Thanks, appreciate that. Grace, anything to respond, or Megan?
There's one from Gillian. What is the time that young people are at risk of a second injury? Is it 6 weeks until blood's normal again? With the adolescent population, we pretty much are saying they need to be off sport for at least a month. Contact sport. So yes, it can take 6 weeks for their cerebral blood flow to normalize again, but some of them can be completely symptom-free by that stage. But we generally, for young people, we'll pretty much say we're not letting them do contact sport for a month. That's my rule of thumb that I'm using in my practice. Then it said in patients with chronic symptoms related to exertion and heart rate, is it too late to improve this months after concussion? No, absolutely not. There's great evidence. I think you also need to consider treating them more like you would a chronic pain patient. So you're going to use more your pacing, your graded exposure. As with anything, the brain is neuroplastic, and you can totally improve these patients. They might need to be seen by a cardiologist and doing a tilt table test. We then just need to make sure that they're always hydrating correctly, and we're watching their heart rate and checking that they don't have any anxiety related to that. So I think, as with any chronic patient, you just have to take them a bit slower and just really support them through it, and most of them can get back. I've got some patients that I've had one matric who's had to repeat matric again this year, and he's basically getting back to all his cricket now. And he was having syncope. He kept passing out in the bathroom at school and knocking his head, of course. And so he's managing to get back into provincial cricket now, and he's doing beautifully, but it took us a whole year. But we can get there. That was from Gillian. Marlene, would you treat them if they have whiplash? I still wouldn't treat them for 48 hours, generally. I normally ask them to have their 24 hours break, and then they need to contact me after 48 hours. They need to try and do 20 minutes of exercise, even if it's just a walk. And then they're most welcome to call me. And then I will treat them if they do have whiplash. But remembering that it makes them feel like they've been hit by a bus. I pretty much tell them, please don't come here on your own. Make sure someone drives you. So I will treat their neck. You also need to be very careful with the whiplash. If they have got visual fallout, and that happens in about 70% of the cases, if they have visual fallout, they are going to use their necks to brace themselves. So if you then treat their neck, you're then taking away all their support to try and keep the head upright. Because they're feeling unsafe and their vision is all over the place, they're bracing with their necks to help them to hold themselves up against gravity. So if you treat their neck too early and you haven't organized their vision, they can actually get way worse. And 48 hours later, they feel even worse than what they did before. So I do, if they have got a locked facet, for example, and they can't turn their head right, yes, I will treat that. But I'm not going to do a full 45-minute session on their neck. No. I will give it at least, I will do the VOMS test, see if they have any vestibular oculomotor fallout. Then I'll ask them to do majority eye exercises, and then they can come see me in a week's time. They can use hot packs, they can use anti-inflammatories, they can do gentle stretches, but I won't do a full neck session on them. I hope that helps. And then Christelle, I have read that you should drink caffeine in the first days. I haven't read anything to support that. Unless they might have migraines. I know caffeine has been supported with migraines just to help with vasodilation, but I generally wouldn't do any alcohol, any stimulants for at least the first 10 days. I would take that away as much as possible, because just think it's just adding more confusion to their brain. Their brain's trying its best to normalize their metabolism, and now you're giving another stimulant. So I wouldn't do that. Do you think children should be removed from play even if they don't have symptoms immediately? I think it's totally how circumstances. I think you need to see if they are looking fine, and you have to remove them if you think they've been hit. I would do a mini head impact assessment, like I do the SCAT-6 on the side. So there's something called the SCAT-6, child SCAT-6. And that is for ages 5 to 12. I would then do the SCAT-6 children's one. And then if they pass all of that, then they are welcome to go back to play again. But if they don't have symptoms immediately, there's very little that you can do. But I would take them off the field and assess them properly, make them do a balance test, make them do the memory recall, ask them about any symptoms. And if they pass that, then they can go back to play. I think you can only do as much as you can do.
Megan?
Yes.
I'm going to stop you there.
Cool. Thank you.
Thank you. Thank you so much. So nice to see you again.
You too.
Yeah.
Thank you for the opportunity.
No, thank you very, very much for jumping in as you have done, and incredible talk, so informative, up to date and everything. Much obliged. Thank you.
Thank you very much.
Enjoy your Sunday. Back to your kids.
Thank you. Thank you. Bye.
Okay, bye. Okay, right. I'd like to introduce our next speaker who has already contributed a little bit with his recollection of the concussion injury in cricket back at the World Cup, Craig Govender. Craig and I come a little bit of full circle here. We interacted about 20 years ago when I was still working in cricket in the UK and Craig was getting into cricket. And he got pushed and directed in the correct direction. And as you can see, his career has really gone from strength to strength and has blossomed all the way to the top of international cricket and working for the Mumbai Indians and super successful. So Craig, lovely to see you, mate. Thank you for agreeing to present on the Sports Econ today. You're going to be talking on a specific cricketing incident or a specific cricketing injury. So kind of a case study, which is really nice and something different. So if you'd like to share your slides and go right ahead, that would be appreciated. Thanks, mate.
Okay, let me just try and share that. Can you see that?
Yes, undiagnosed
Okay.
FAI syndrome. Yeah.
Okay. Thanks for having me, Craig. Yeah, we have come full circle. Not many, I don't think even you know this, but in my university years, in my essay to university, I said I wanted to be the next Craig to be the South African cricket physio. So yeah, I eventually got there. So thanks for that.
You weren't the next Craig, but you followed Shane and Brandon.
Yeah, the name Craig. So
right. yeah, the next Craig. That's correct. Yeah.
Cool. Yeah. So thanks for having me on this talk. And as we know that cricket's quite an overused sport. We deal with it regularly in terms of overuse types of injuries, chronic pain, etc. The amount of overuse injuries is quite prevalent and quite high in comparison to acute injuries. And lower back issues, as particularly in fast bowlers, is probably at the top of the list in terms of time out of the game, and you know, causing fast bowlers to be a bit frustrated with the injury. And there's a hell of a lot of research done on stress fractures of the back and the management of that and the amount of time out. But being on the ground and being in the room with a lot of cricketers and trying to find ways to prevent this type of injury has brought me to this hypothesis of the hip. And as the cliche goes, it could be all in the hips, but it's one of the areas I'm looking at, apart from bowling loads and mixed actions and a whole lot of other different variables that causes stress fractures to the back. I looked at femoral acetabular impingement and not just looking at the back and various other cases. In my career, or particularly during COVID, as you'll see coming up, I've seen a few case studies and a few cricketers that actually, when diagnosed or when looked at the hip, actually had FAI. And we tried to help that area to help the back. So this is just a case study and a hypothesis. So before I go on, there's a bit of a disclaimer that the presentation is based on observations in clinical practice. And it's actually not been researched much. I've searched high and low for stuff on femoral acetabular impingement on cricketers, and there's not too much around. So I use different researchers to come up with different hypotheses. Okay, so let's start with the case study. It was a youngster at the time, probably 20, 21 years old. He came to me in 2020 complaining about right lower back pain and right hip pain. And if many of us understand the stress fractures of the back, we know that if you're a right-hand bowler, you're probably getting left-sided back pain, and which becomes a yellow flag to really look at the back in terms of stress fractures. But he had right-sided lower back pain and right hip pain. His concerns are that he still had symptoms for 8 weeks, after 8 weeks of lockdown. I want us to think about the lockdown period, and the story will go that it actually caused some effects on cricketers in the sense that I was looking at them at that time, and he felt that strength sessions and shadow bowling also caused discomfort. He initially had symptoms during a T20 competition in December 2019 and was removed from the competition to have an MRI done, which showed stress fractures to L4, L5, and that's generally the area we tend to find stress fractures of the lower back to fast bowlers. Subsequently to this injury, he was decided to add undivided rehab and strength training done. He eventually made a return to play prior to lockdown, but then fell on the right hip during a fielding session. So then he came to me again and we did an assessment. At the time I was with the Proteas and he was a high performance player, and I'm currently based at the Wanderers. So he was a Lions player as well. And he grew up in front of me in terms of coming into the team. So he reached out to me to have a look. And right hip pain was never present in his previous reports. So then an MRI was done on that date. I looked at an MRI of the lower back. I looked at an X-ray as well of the hips. We did hip MRIs. We did blood tests as well, because I did not want to miss out anything. And I did a leg length discrepancy X-ray, because in the clinical room, we often do this, the leg length tests with measuring tape, etc. But we will find a true leg length discrepancy with an X-ray, which came back quite normal. The reason why I looked at the leg length X-ray is because his hips were rotated in a standing position and he didn't stand in the normal plane, so to say. His lower back has had improved significantly with the new MRI, but there were chronic issues to his hip. We then requested him to see a hip specialist, and an arthrogram was done. And with the arthrogram, we're obviously going to see a bit more. And he had a labral tear. It showed a FAI, and he had a rectus femoris grade 2 change to that area, which is a symptom of an FAI as well. The surgeon at that time said he would probably need an operation done. And for a 20-year-old, that was quite tough for him to take, and we had to relook at a lot of things. So with the FAI, he had the following symptoms: pain and aching, and that was and the understanding of groin pain is of particular interest to me as with FAIs, because it mimics quite a lot. So it's an area that we can almost know if in the future that if there's but a groin pain without a mechanism of groin injury, we could relocate it to being the FAI that could have exacerbated or caused inflammation. It's important to know that with the symptoms of an FAI, there's pain with walking and prolonged sitting, a locking, clicking, and catching sensation of the joint, pain sitting for long periods, again, sitting, hip flexion, difficulty putting on socks and shoes, difficult walking up hills, back pain, again, a relation with the back again, pain in your SIJ, and yeah, and these were the type of symptoms he had coming in. So we had, looking at this assessment, it made me think quite a lot more of where could this, why is he having continued back pain? Now, this was his history. Now, he was 20 at the time, and he has had various different back issues. As you can see, that was his history. History taking is so important to paint the picture and look clearly and hard at a particular individual. And you can see initially he had left-sided stress reactions in 2017, again in 2019, and then in 2019 again he had right-sided back pain. And then whilst doing this presentation, I asked myself, what if we assessed his hips or looked at his hips then, many years ago? And I've come, are we looking at the right place all the time in terms of lower back pain to fast bowlers? This was his X-ray done. As you can see, his right hip has a pincer. He has issues on both sides, but you can see a significant issue on the right side. Now, this doesn't just come about immediately it comes over time. Remember, it's a growth plate area as well. And cricket, again, is an overuse type of sport. So we need to think about the repetition of back foot landing. It was his right leg, right? So understanding left and right and what left and right does at the crease. So in this case, it was his right hip. And a lot of the time, the right hip is a significant factor in cricket as well, not just the loading front leg, which would be his left in this case. This was the result of his MRI scan as well. And it showed that the right had a cam, significantly shows that. And these were the comments. The right cam, FAI, it shows a few different changes, but it's all chronic related changes at the age of 20. Many of us would have probably seen this in the clinical room, but we've seen this quite a lot now. I go a lot more just looking at than just MRIing a lower back. I do a lot more hips, and we have different types of FAIs. As you can see, a cam versus a pincer versus a mix. Okay. Now, I lived during the COVID era and bio bubbles in cricket. Very tough time of sport and international sport, where we were basically prisoners in very luxurious hotels, to say the least. But it was quite a tough time, and I found that a lot of undiagnosed hip issues started popping up. Now, why would it pop up during a bio bubble during COVID? And if we understand the mechanism of the description of what the players spoke about right at the beginning, and what happens with long sitting and what happens when we sit for that amount of time to the body, we kind of figure out what happens next. So during a bubble, we are unable to leave hotels. We were on long flights. Quarantine periods were between 3 to 5 days. So you're in your room and the only thing you're doing is sitting. And there were a huge amount of video games being played, which meant there was poor posture. Many became poker players as well. And there was a huge amount of long sitting, hip and lumbar flexion. So with looking at all this, I had to look to break the flexion pattern. Now, research also shows us that there's a correlation between decreased hip range of movement and lower back pain. And this is quite a relevant research study that was done. There were 124 articles. It was done a literature review, as you can see, and 12 met the inclusion criteria, which is a few amount. And the conclusion was that based on the observations, we conclude that there is a close and strong link to lower back pain and limited range of motion, especially in hip internal rotation. Now, hip internal rotation, we often use a test in our clinical practice called the FADR test, which is forced internal flexion and forced flexion and internal rotation, right? So what happens in an FAI is that when there's bending or internal rotation, there's a lot of, as you can see in this little picture, signifies a bit of bruising and inflammation in the hip joint. So a lot of internal rotation and bending, and meaning flexion, does cause an irritation. And reading a bit more, this popped up. The diagnosis and treatment of patients who have both hip and lumbar pathologies may be a challenge because of overlapping symptoms and may delay correct diagnosis and treatment. Common complaints of patients who have both hip and lumbar pathologies include lower back pain with associated buttock, groin, thigh, and possibly knee pain. Again, this is quite a significant comment in the research, because the correlation, there is a significant correlation between hip and lower back pain. And in the clinical room again, I mean, on tours, we gotta back our clinical ability, because when you're touring in some areas that don't have the best MRI scans or around, you got to back that. And sometimes there's only one scan in the entire country, so you could only wait a week or two to get a scan. It's important to understand your clinical reasoning. And these are the common tests used for hip and lumbar pathologies. But I wanna highlight the FADR, the flexion, adduction, and internal rotation test, which is often used to try and diagnose an FAI. But there's a lot of research that does it may mimic pain, but currently it's not seen as extremely sensitive in terms of giving us the correct diagnosis, because imagine how much things are happening around the hip in that particular area. That's why you'll see as we go on, imaging becomes important, but not necessarily to rule someone out. In our case on the field, it's important to understand the player, what may be causing symptoms, what may be causing pain, because playing is vitally important for players because of money, time, and your coach. So we need to figure out how best to manage players with issues like an FAI. So we should look to assess the lower back of fast bowlers. We should not only just look at the lower back, but also look at the hip when we're looking at issues with fast bowlers. As I said, there's not much research on this area. Hence my disclaimer again, this is a practical clinical hypothesis. And here I go again with the test, the FADR. And it states that the test is inadequate in screening cam and pincer issues. I used this research because I tried to find much on cricket, but again, there's not a lot. So in the room, in our clinical rooms, we do use this test often, but ultimately, we do need to have imaging to give us the correct diagnosis. And often an X-ray can show us a cam. Why do we need imaging? Because we have so many other pathologies in the hip. The hip, I see it, all of us see it similar to the shoulder, which has so many different pathologies in itself. And this table is quite a good one because there's so many different, there's intra-articular issues, there's extra-articular issues, but how are we going to find the exact diagnosis? And finding the exact diagnosis at that level allows us to give the player exactly what he needs in terms of understanding the diagnosis. If there's a prognosis required, we can do a return to play protocol. But most of the time, especially in the hip, we can look to change up activity, and that's where I'm going to come at in the presentation coming forward, is that knowing that what we have, what do we do now? So we understand there's an FAI present, and now what? So in this player's case, the case presentation is that it was undiagnosed at the time, and he had recurrent back pain all the time. Now, what was immediately done, knowing that this was the issue, and we're not going to have surgery because as you could see, surgery is going to put someone out for an immense amount of time. So we had to figure out, how do we heal the lower back, because it's still a lower back issue? How do we heal the hip? As we see, there was a hip issue. We had to start modification of his program. And that's understanding now that a hip probably is causing a lower back issue as well. So we had to understand his strength program. Sometimes less is more. And this is what's come up quite a lot in dealing with the elite athlete, is that we don't it doesn't mean that we have the position that we have to make sure that we have to tick the box and make sure that he trains every single day. That's like, in this case, it actually would have caused more harm. So the activity modification was very, very important. Again, the mechanism of an injury of the hip, especially the cam, is hip flexion and internal rotation and overuse type of stuff. So a deep squat is not going to help him. We had to minimize hip flexion and lumbar flexion. So doing 1,000 ab crunches is not going to help him either. So speaking to the SNC coach, speaking to his bowling coach, making him understand that this is the situation. We need to modify a lot of the areas that could be causing discomfort. And we did that. And during that time of modification, there was a definite betterment in his mind, less pain, less discomfort, etc. Education was then very important. So obviously understanding the diagnosis. A big area we look at is groin pain. So if you're having groin pain with the FAI, it means there's a bit of inflammation in the area, and it's being exacerbated by possible movements, maybe too much bowling, reduction of that, understanding all those types of areas. Understanding the Trendelenburg, this player did have a Trendelenburg gait. So understanding what was happening around that, how to modify that, how to change that, how to rehab that, getting his glute firing, which is very important in bowling, because his back leg, which was his right leg, if you're not strong in your glute and your VMO, you're going to collapse and that there's going to be a lot more pressure on that hip. Running mechanics is a very, very important area that's probably not used a lot or trained a lot with athletes, especially in cricketers, because you can change patterns, you can improve patterns in terms of understanding the better mechanics. He needs to know that he can't be tinkering too much with his bowling action. A lot of bowlers tinker quite a lot in order to get the right hip to drive through the crease, the back hip. I mean, every bowlers get a lot of power and speed through the hip drive, which is the right one again, which links up to his injury. Breaking flexion. So we had to enhance extension type of exercises, a lot of Mackenzie stuff, a lot of hip flexor and quad stretching. And then knowing that he has FAI, what does that mean again? So it's similar to my understanding around having a shoulder impingement and doing our famous sleeper stretch. If it's causing discomfort, why go through it? Because it's just going to cause an irritation. So I removed mobility exercises like the pigeon stretch and the frog stretches, because often we think that there's decreased range. We need to stretch and stretch more. Now that we know that there's actually a reason for decreased range of motion, do we actually have to force the issue? Because we could actually be making him more painful. The rehabilitation program was done, again, making sure that we rehab the back, which was the issue, rehab the hip, a lot of glute stuff, a lot of hammy stuff, mobility stuff within a reasonable pain, not a lot of pain. So mobility does need to be done, but not too excessive. Workload management is a big key word used in cricket and a lot of sport these days. Understanding bowling loads of players, understanding their action, how do they get through the training at the time. And when you're getting someone back into cricket, obviously you can't go from zero to hero, sorry, the other way around. So starting him up again, get him to understand his bowling action with the coach. I think the coach was vitally important in his rehabilitation process, together with the SNC. And knowing that he had this issue again, a lot of regular physio was required, a lot of manual stuff, a lot of mobilization with movements and belt stuff that I used to loosen up the area, soft tissue work around the back, all that, just to free up the hip a bit more, to get a bit more rotation. Remember, cricket is there's a lot of rotation going through that hip and that lumbar spine during bowling action. So trying to repair all those types of areas. And I like, I mean, we spoke about it, we think about it a lot and we speak about it, but everyone is an individual. In this case, this young man had a lot of discomfort, a lot of pain in his career in terms of lower back stuff. We had to dig deeper to understand why is it becoming recurrent for so long in his career, and looking a bit out the box and trying to figure out certain other issues that could be causing discomfort and pain. We looked, like I said, we looked at blood tests. We needed to know if there were inflammatory markers, were there rheumatoid arthritic issues in him, making sure there was no leg length discrepancies because his posture was such, and making sure it was extremely valid. And then really looking at the hip in more detail. Again, like I said, it's just a case study, and due to this case study, we started looking a lot more into the hip, going through COVID, looking until now, and understanding that yes, back pain in fast bowlers can be due to, like I said, many different variables. But we added one more to the case of lower back stuff in fast bowlers, and a bit more emphasis was put into dealing with hip issues and making sure that guys are more stable at the crease, making sure their glutes are firing, making sure their hammies are strong, all those types of things. And because it's Wimbledon final, Craig, I think it started. I thought of showing you this little example of one of the few sportsmen, professional sportsmen that actually had a resurfacing done and made a return. And I'm not sure if any of you guys knew that Andy Murray did a procedure called the Birmingham hip procedure. And in my career, we had another cricketer that had a lot of hip issues in the past. And we actually made contact with Andy Murray at the time and his physio to understand this procedure in more detail, because at the time, this cricketer, and not the cricketer that we're talking about, another cricketer had extreme pain in the hip. But what came out was that activity modification and understanding a diagnosis of what's actually happening in the body of an athlete helps the athlete a lot more. We don't necessarily need to dive into surgery or tell them they're not going to play, because at this stage, the cricketer I'm talking about was one of our national captains, and you're not going to tell a captain to stop playing because of hip pain. But we had to understand exactly what was going on. He had this issue for many years, but not understanding how exactly we need to tailor his programs for him to continue playing. And through looking at other sports, and this is a big thing that I think a lot of us should do, is that we don't necessarily just have to look at the sport we're playing, because there's a lot of guys out there, and a lot of people want to interact with other professionals around the world. And Andy Murray in this case was pretty good in helping us. His physio was extremely good in helping us. The Bryan twins, I don't know if Bob Bryan, they won a lot of doubles. He was also quite helpful. And these types of things makes athletes a bit more comfortable knowing that someone went through a situation similar to what they're going through. And it helps us as physios as well to settle the nerves. It makes us learn and understand that, okay, you're not alone in the situation. And there's a lot of people out there that's willing to share information and help in getting players better. And in this case, activity modification, in the case of the case study and case of this captain, actually helped with the hip and with the back issue. And I think we all know that we don't look at things in isolation. And yeah, in this case, we didn't look at it did not look at it in isolation, and really tried to find where the problem could be coming from. And where is the case study at this present time? Since COVID, he hasn't had hip issues. He's looked at modifying his programs, understanding his body a lot more, and yeah, he hasn't been injured. He's been playing. He completed 2 full seasons of cricket without missing a game, which was massive for him, because like in 2017, being a schoolboy and being through growth spurts, he developed issues. And yeah, I think sometimes less is more. We don't necessarily need to tick boxes all the time and think we have to do too much work all the time and draw up these elaborate programs. but sometimes just not sitting for too long may prevent an injury from occurring. And in this case, it was one of the things that we stopped and tried to break flexion, and yeah, just added a bit more detail. The detail is in the DNA, as I said before. Everyone's different, understanding different elements of each player, and that's how we helped this little kid play more cricket. Yep. Thank you. I hope that was okay.
Thank you,
Questions?
Craig. Yeah, great presentation, very interesting. I've just asked everyone to put their questions in the chat box. No questions yet. I've got a question for you. Sorry to put you on the spot.
No.
I'm curious to know what the clinical or biomechanical connection is between FAI and lumbar stress fracture. Is it a reduced function around the hip joint? Is it reduced rotation or mobility around the hip joint, or is it just the reduced shock absorption, shock attenuation of the joint that leads to more stress further up the chain in the lumbar spine? What your feelings about that?
Yeah, I definitely think it's the kinetic chain involved and the centripetal forces through ground force reactions. Think about there's a lot of stuff being said about the landing, the feet on the ground and the amount of force going through the body. Decreased range in the hip and the SIJ translates through the hip, and we found that by loosening up those areas regularly, guys were able to get through the crease a lot more better in the action. So I don't think we should disregard those forces that come through the ground and through the joints up to the back.
There's a question from Marlene.
Yep.
Do you think the FAI came before the lumbar stress fracture? Which is the chicken, which is the egg?
Yeah, so that's what the question that I posed at the beginning to myself. I mean, in 2017, if we had to probably look at, if we had to assess the hip at that stage, like I said here, could that have prevented something from arising in 2019? We don't know. We do know that FAIs can occur due to growth plate issues, guys going through growth spurts, etc. So, like I said, more research needs to be done in this field to give a lot more valid answers.
Sure, yeah. And the other anomaly was that it was the stress fracture on the same side of their bowling dominance, wasn't it?
It was actually the
right hand.
It was the. So in 17 and 19, you can see there he is a right-handed bowler and he had left stresses, which is the normal occurrence. But in 19, he developed a right-sided issue or bone reaction and a right hip issue. And we're finding a lot more in cricketers these days that we're actually getting the opposite side being injured as well. And that's happened with a few cases with me at the moment. And they've been in surgery for that. So it's an interesting part. There's some interesting things happening in the back of fast bowlers at the moment, and that's why I've delved a lot more into understanding why is it coming to the opposite side now.
Okay, if there aren't any more questions, then there is one more question from Purani. Craig, quite often fast bowlers are getting hip flexor tightness. Well, it's more of a statement. And you mentioned about the whole COVID thing and hotels and sitting around and all that kind of stuff. Yeah.
Okay. Is that a
Any relevance? So the question is there any relevance for back pain related to tight hip flexor?
I think the tight hip flexor will get us to get more into flexion again, and it's not necessarily going to cause. And as I said, it's there's a lot more happening with fast bowlers in terms of what the severity of other variables in terms of bowling actions, etc. I don't necessarily see a tight hip flexor causing a lower back issue.
Okay, Craig, thanks so much, buddy. Appreciate it. Thank you for your interesting case study and presentation. Yeah. Gonna let you go.
Thanks. Thank you.
I'm going to hand over to, thank you. I'm going to hand over to Saurav. Saurav is going to introduce our next speaker, Alagapan.
Thank you so much. I would like to extend my sincere thanks to Sir Craig, sir. He has nicely explained about the X-ray and everything. It was too good. Wonderful. And now with this, we have come to the almost, is the last presenter of the day. Yes. So Alagapanti, sir, I think he has joined also.
Yes, sir. Am I audible?
Yeah. Thank you, sir. Thank you. It's always a pleasure to learn from you, and many a times you have done with us, and many a things we have learned from you. And the guys, sir is a wonderful professor, and he's associate professor. He's a senior physio in Chetinath Academy of Research and Education. When I say research, yes, definitely I mean it, because sir does a lot on field, off field, and he has a lot more experience with the players and budding athletes. So kindly enjoy his topic today, and then he is going to talk on managing day-to-day activities in cricket field. So just see, like sir, you can share your screen. Managing cricket players during competition, a day-to-day approach, like how it has to be done, and it's very practical topic, and we all are going to learn, I'm sure, a lot from this, which is actually the part of our practice. Sir, kindly go ahead.
You can share your is my slides are visible?
Yeah, it's visible. You can just make it full screen, sir.
Yeah. How about now?
You can make full screen.
Yeah, I made the full screen. Like, is it visible now?
Yeah, yes, very much.
All right, pleasure. I'll go ahead. So thank you, Club Physio team, Craig Smith sir. So thank you for the opportunity provided.
It's not bad.
All right. Thank you. All right. So before starting this presentation, I have a short introduction about me. Saurav has said enough about me. So this is my 15th year of physiotherapy practice. So last 8 to 10 years, I've been working in sport, and last 3-4 years, I have been involving with sport along with a bit of academic and research activities. So this presentation is all about sharing from the experience which I gained from working with cricket players. And most importantly, I am going to share a lot of existing evidence which is available on managing cricket players during competition. So earlier today in the presentation, I had a look on Mark Brown's presentation. It's like a complete full pack presentation where you will have bit of glimpses of this presentation with mine. So it's going to be useful, guys. So let's move on further with the presentation. All right. So this is the overview of my presentation, where we will be having a look on cricket and its specific injury rates, and the player and his relationship with cricket. And I'll have an idea. We'll have a look deeper view on how the sports medicine, science team, and the coaching team involved in cricket. And we will work on have a look on about the 3 important core parts which we work as a sports physio. One is the pre-season preparation. The other one is working during the match time, and the third one is the post-season works. And last, I've got a lot of articles on overview of what research says. And there are a few parts which we can get advanced as for the professional betterment. So let's move on further. Right. We all know cricket is a global popular sport which involves fitness, skills, and strategies. It is a
Sir,
non-contact sport.
1 second, sir. So can you make it big? On the slides are not moving actually, and please make it big.
It's moving. How about now, sir? Like is that moving?
Yeah, please go to that view option
Yeah.
and make it big.
Yeah, I made it. Is that visible now?
No,
It's
not.
visible. It's not full screen, sir. You can go down and can make it full screen. Just down, there are 3 symbols. No, you can just make use of that, like slides or something like that. Just down.
Like I have like
Yeah,
from
just
the
below the overview. Just below the overview.
below the overview.
Yeah, you have just below the overview. You have 3 signs, right?
Yeah, yeah.
Just here at the down, you will have one slide. So also, so you can make use of that.
Okay. Is that
No. Just near that. Just another one. Yeah, either this or the last one slide. So, yeah.
I didn't.
No, not that one.
So you can.
Just
Not that
press
one?
F5.
I think you can use F5 to maximize the screen size.
Is that visible now?
But is it visible? It is visible, but it is not in the full screen.
It's not in the full screen. Okay.
Probably you can use F5 to view full screen.
I have done that, but it's not like I think it's, 1 second. Okay. Is that fine now?
No, still it's the same.
It's the same.
I think probably you can double click in the slide.
I will try that. No.
So please
I
try
will.
again. So
Yeah,
please try
I'll
again.
reshare. Yeah, I'll reshare it again once. All right, perfect. Yeah. So we left from here. So the overview of my presentation is we are going to see what is cricket and its specific injury rates, and further from there we'll see the player and his relationships with cricket, and we'll have a look on how the sports medicine science team and the coaching team involvement with the cricket players, and we will come to the core part where we will have a pre-season, what we do with the pre-season and what we do during the match days and also with the post-season works. And then finally, I'll share a bit of overview of what research is and which part we can get advanced for the professional betterment, right? So we all know cricket is a global sport which involves fitness and skills and strategies. And it is one of the non-contact sports where overuse is common, as Craig Gowan said, like it's very common. And we also get some impact injuries, and it is common since cricketers involved with skills like batting, bowling, catching, running, throwing, and diving. All sorts of mobility or all sort of sporting specific movements happen with the players. And we all know that cricket has been converted as an high intense one. Now it is like we have T20 formats, 1 day and test matches, and we have a lot of franchise based cricket. And when I went through literature search, I got this injury prevalence for the batsman and bowling specific injury rates, where we can see in this slide where batsmen are more prone for elbow and wrist specific injuries. And moving further, they are very prone for back, ankle, and groin specific injuries. And batsmen also get some head injuries with finger injuries also. So these are the more specific injury rates which you can see on batsmen, right? When it comes to bowler, it all starts with shoulder specifics. From there, bowler is more prone for getting an ankle sprain or an ankle specific injury. Then followed by that, the third part or a third maximum situation of getting injured is back and meniscus based injuries, particularly the knee based injuries. than the elbow specific. Also, we can see in normal days, a bowler also gets struggled with hamstring specific injuries also. So these are the two common prevalence which I got through a literature search with batsman and bowling specific. Moving on further, this is an article which has been done by an Indian where they collaborated a comparative injury profile. They did an injury profiling with South African and Indian players, as like we do now. So in this, we can see uh, the activity causing injury in cricket is more on like during the bowling phase, and followed by that there is more chances getting on batting phase than on fielding phase. But in the Indian author who has done the literature search, he has said like there is some sort of probability getting during wicket keeping also. And you can see on the other part of the slide where you can see the prevalence of which we got from modified Macbeth and A-Finch paper, where you can see hit by the ball, hit by the pad, fall or trips, overexertion or overuse injuries, finger injuries while catching, collision with the other player, diving for the ball. All these are the common occasions which happen during playing cricket. And you can see that most probable things have been with the specific movement which happens with the sport. Moving further, I got this from another article where the risk factors involved with playing cricket. They have classified into two, which is both intrinsic and extrinsic factors. The intrinsic factors involves two categories, modifiable and non-modifiable. In modifiable, you can see the fitness levels are modifiable. The sport-specific training and warm-up can be modifiable. Muscle strength can be modifiable. Flexibility, joint stability, biomechanical factors, the balance and proprioception-based factors, and psychological factors. These factors are modifiable. But when it comes to non-modifiable, age, gender, maturity level, and previous history of previous injury, or most of the things are like non-modifiable. When it comes to previous injuries, there are few injuries which is like completely curable or just manageable injuries seems to be maintained in the good phase. But there are few existing injuries which won't allow the athlete to perform more better. Those kind of injuries cannot be modifiable. When it comes to extrinsic kind of factors, the rules and regulation of play, coaching, education, and training aspects, play time, playing surface, and most importantly, the equipment used on the training basis, and sorry, equipment used on the training phase, are all those factors which is modifiable. And when it comes to non-modifiable factors, the type of sport which they play and the sport context which they get involved, the climatic conditions or the weather conditions, and the level of play. The most important thing is the level of play, time of the season, and the playing position. All these things are few times, most of the times it is going to be non-modifiable. This slide clearly explains the player and his relationships. It is very clear that now at present, earlier there was a single point of contact where the primary contact person like sports physicians and sports physiotherapists who acts like a case manager. So they get involved with the athlete who got injured. And always when the athlete got injured, it's going to be the team approach where other professional who doesn't involved on on-field injury management comes to play to manage the athlete in a better way. And the other way is like the sporting organization, the athlete and the coach has an emotional diamond base of relationship where you will have a good interpersonal relationship between the coach, the athlete, and the organization. So it is very important that a medical professional like a physiotherapist or a sports physician acts like a case manager, and it is most important that they had to get involved with the other professionals, other professionals like podiatrists or a biomechanist or an exercise physiologist. Right now in the place where I work, we always work on the team approach. I work with the Department of Sports Medicine where we try to work integrated approach. So team work better. And India, people like me, we are trying to work more on an integrated team approach in India. We are just trying to move towards that position. Earlier, it was like an individual physiotherapist who have been working with multiple places. But now we are trying to work and integrate in a team approach. Right. And you all be aware about this. Thanks to Buckner and Khan. It was clearly indicated that the athlete and the coach is the central person and they will be connected with a multiple centric team. Multi-centric team consists of physiotherapist, massage therapist, podiatrist, trainer, physician, dietitian, psychologist, etc. So it's a team approach. All right, moving on to the second part, what as a physiotherapist I can do during day-to-day approach on managing a player. The first thing is you have to do an injury surveillance. From there, you need to determine the etiology and mechanism of the injury happens to the individual cases. And you need to develop an injury prevention measure programs. That's very important. And there are a lot of scientific evaluations done particularly in specific to injury efficacy, assessment under ideal conditions. You need to assess under an ideal condition. And you need to describe the intervention context to inform implementation strategies. So all these interventions which you're going to apply should be on the basis of implemented strategies. And the most last important thing is you need to evaluate the effectiveness of the preventive measures in implementation context. So it's like a combination where you need to do a prevalence, you need to be with a good teamwork, you need to have a good interventional approaches, and all together with you need to have an effectiveness of preventive measures in implementing context. Right. Moving on further, this is what we all do as a physiotherapist and a sports medicine physician, where we try to take a history of the injured athlete, where history consists of taking effective history, the environment where the injury has happened, and most importantly, sport-specific application and the individualized approach. From there, we try to do a evidence-based medicine in the approach by means of physical and special investigation. And yes, we need to club with both physical and also the medical-based diagnostic tools like radiology and blood, all along with the special tests which we do needs to correlate each other. So that's where you need to get the examination done. From there, we will come to appropriate diagnostic criteria or a clarity. And you'll also have anatomical and the pathological, or it's a functional. You will come to a criteria where it is purely an anatomical issue or a pathological issue or a functional issue. The most important part with the management side is you need to do or integrate the best medical services with patient or an athletic expectation, environment, and the clinical experience. You need to bring all these three into your practice, and you need to do a preference versus evidence approach. You have to prefer the athlete, you have to work on towards the athlete's requirement, and as well as you need to work on with the existing evidence, the best available evidence for the athlete better. From there, you need to have an effective communication, you need to have an effective implementation strategies, and you also have to work on prevention strategies. Now we have come to the core part of the presentation. How do you do on the pre-season part of the cricketing assignment? So the first thing which I've also noted on Mark Brown's presentation, where it is very clear that you need to get to know the terms and conditions. You need to check how the sport is. Particularly, you need to know about cricket in a much better way, and you need to know about the terms and conditions. And most importantly, you need to know about the assignment duration, and you need to have a plan. So you have a properly signed contract, which consists of all those rules and regulations of the team management. Along with that, you should also have an idea about how to manage on yourself, right? And most importantly, the contract should be with all those terms and conditions, which is record from the team side also. From there, you need to have a plan on strategies for ourselves and also with the support staff team. So it's not a single individual approach, it's a team approach. 1 second, please. 1 second. Hold on a bit. Thank you. So as I said, you have to have a plan and strategies for ourselves, and also you have to have a plan with the support staff team. It's a collaborative approach, and it is not a single individual approach. And in the pre-season, the most important core part is you need to apply or implement various level of assessment like musculoskeletal, medical, nutritional, psychological based assessment based on the requirement of the athlete. We'll talk about that in the upcoming slides. And most important thing is to stick to your roles and responsibilities. Work with the other professionals in an ethical way. Yeah. Right. When I said about when we talk about physiotherapists and the team of professionals should work with a design plan. And the most important thing is you need to focus towards injury specific rehabilitation. You need to work on performance enhancement and injury prevention approaches. And all these things can be done with the team by means of combination with documentation, treatment, training parameters, and applications with latest gadgets, and most importantly with assessment specific also. And most important thing for us physiotherapists during the PE season is you need to get prepared with a team kit and essential materials. Ensure that you have everything A to Z with you. And most importantly, it should match for the player's requirement also. And talking about the assessment, there are several assessment available for the player specific requirement. It starts with the medical screening. You have to do physiotherapy specific assessment and screening. SNC, nowadays sports scientists get involved in that, and sports conditioning specialists also get involved in that. So they are also a big part on fitness. They play a big part in fitness. And most important thing is nutrition, where it is being done by the nutritionist, psychological assessment, biomechanical screening, and any kind of sports specific assessment has to be done for the player's requirement. So most importantly, it is a collective approach. And as I said, teamwork matters here. And you need to do a cross referral, which is very important. Ensure that the athlete gets the best needed assessment done or the exact required assessment done. That is very important. Okay, during the pre-season camp and practicing days, always the cricket starts with the pre-season plans, and followed by that, the team get involved with the practicing sessions before they are getting involved with the event or a set of playing days. So where you can make the decision making on injury progress. You will come to know better about the athlete during this phase. You will come to know a much better idea about the player during this phase. You need to monitor the training sessions. And you need to do working on appropriate injury rehabilitation protocols. So ensure that you have done a collective assessment and you have done a proper rehabilitation protocol for that backup. And you need to implement appropriately for that. And you need to check for the supportive applications like taping, wrapping strategies, or any kind of supportive application, bracing support, anything, which is required for the player. And this is the phase where you'll get to know about the team players, supporting staffs, the team culture, and the environment during the pre-camp days. And you can plan based on the team schedule also. Every day, this team will have a schedule on how to work on, how to do a training process, how to do their practicing time and all. You can plan accordingly. Your plan can be matched with the team schedule. During the match day, the key is to prevent the key is prevention here, and you need to prevent the injury, and you need to manage the existing injury, not to get worsened with the further injury. As I still remember, I recently went through Mitchell Stark's interview where he says like out of like several matches he played, there is 1 or 2 matches where he played without injury. So any athlete who's playing will be managing with an existing injury, or they will be getting involved with some kind of betterment. So for me, it's like no athlete is completely 100% stronger enough to get involved in the match days. So along with that, you need to work on, when it comes to prevention, there comes taping, bracing, and wrapping supports. You have to have a key application on that, and you need to work on that. And you need to get implemented with protective gears. Ensure that your rehab exercises routine is done with the athlete, and make sure that your on-field injury management skills are up to the top notch. So you need to be pretty good on managing with the on-field injury management skills. Like you need to have a better idea about the medical conditions and also with musculoskeletal specific conditions. That's very important. Apart from all these things, during the match day, have an idea about assessment during the match time. You need to check with the hydration and nutrition part. You need to check with treating other players who's not playing during that time. And observation is the key during the match days. And most importantly, load monitoring. You need to work with some load monitoring gadget devices. When it comes to load monitoring, this is the data which I got from physiotherapy specific load monitoring, where we can see lower back and abdominal get involved with a lot of loads, followed by buttock, hamstrings, and shoulders, and thighs and upper back, the last part. So we will come to a conclusion that load monitoring also plays a pretty important role. That's why like sports science professionals comes inside, where they will get to know about more on load monitoring. And it is also very important, you need to work on the recovery aspect during the match day. So ensure that the athlete got a better recovery. When it comes to recovery, active recovery is much better when it compared to the passive recovery. So active recovery seems to be so beneficial in compared to a passive recovery. So you can see the pyramid of the recovery in the slide, where sleep and downtime seems to be the base for the recovery, then followed by the nutrition and hydration part. Then comes the ice water immersion, or like a cold water immersion or a hot water immersion. And compression stockings, active recovery or stretching seems to be a beneficial one. Massage plays a less evidence-based thing, but yes, massage also comes to play when the athlete is so tired, couldn't be able to recover actively on his own. And followed by that, you can work with cryo chambers, EMS, vibration, and pad-based treatments. And you can also have a understanding about when it comes to recovery. It all comes with the training and competition happens with the volume, intensity, duration of the sport and time. The nutrition aspect comes to play. The psychological stress of an athlete also plays a vital role here. And most importantly, the lifestyle aspect of the player, health and environment also comes to play here. So ensure that the recovery aspect comes with the psychological aspect and also with the biological aspect, which you need to get involved with the cricketer. So to make him better and to make him better recovered, understand the psychological aspect also and also with the biological recovery. And during the match day, during the break time of the match or the season time, probably let's say a one-day match is happening where you have 2 or 3 days of breaks in between each matches. What you can do there is, for a mild or a manageable existing injury or the match day injury, manage athletes and assess you need to assess and you need to progress the condition. Most importantly, when the condition is progressing into the worsening way, you stop there and you have to make a collective decision making. You need to have a collaborative approach and you need to have a collective decision making. And most important is, once you stop the athlete there or stop the player there, hitting player there, do the essential treatment and rehabilitation with the team requirement. That's very important. And for other athletes who are healthy enough, who are continuing playing with the team, you can work on the recovery, nutrition aspect, hydration aspect, sleep, recovery weights, cardio training, massages, etc. Again, load monitoring plays for both the healthy individuals in the team and also the injured players in the team. So ensure that that's where the science professional comes to play, and SNC professionals comes to play, where they will give you appropriate data for the load monitoring. All right, now we have moved to the post-season. Once the season is done, once you manage the athlete on day-by-day basis, now you need to have a compilation of work done on completed season as a document. You need to convert that the quality of work you've done as a document, and you have to hand over the reports for the report for every player with the work done. Understand that the compiling document will be the overview of what the work you've done, and you can hand over the report to the player if he is having a specific injury. Right. So, and the third most important thing is, when I work with ATP physios with tennis, ATP physio always have a better approach on handling their data to the next assigned physiotherapist. So it is very important you can share your data to the next assigned physiotherapist and they can continue with it. Else, if you are extending with the team, let's say you are working for a quite longer time, you can continue doing with it, or you can continue having the data on your own. Okay, once you leave the team, or once you complete the assignment, you can hand over the data to the next assigned physiotherapist if required, right? And most importantly, you need to handle the reports to the coaches and team management authorities. Sharing your positives and negatives of your workplace is very important. Recently, I've done a volleyball season where they asked me to give a report about what are the positives and negatives happen during the workplace. So it is very important where you can work on the drawbacks and issues happen on the team handling. So that's very important. Every day is learning on handling players. So it is very important that you need to share your good and bad thoughts on working places. Right. So these are the challenges which we face during the team environment. When we work as a team approach, earlier it was an individual approach. Physiotherapists nowadays, as Mark Brown says presentation, we have seen very clearly there are few times we need to work as individual with some restrictions, and there are many times now we are going to work as a team approach, and we are going to work as a multidisciplinary team. So here the challenges comes on taking decisions, in decision on injured athletes, whether to make them play or not. So it is very important you need to have a shared or the individual decision making. there comes a challenge where few will make them to play, few will not allow them to play. So it is very important. You need to have a collective decision making on concluding whether the player needs to play or not. From there, you need to have an idea about handling players and other professionals. So when an athlete is injured or a player is injured, he will be emotionally down. So we have to have a better understanding that you need to handle them in a professional way and ensure that the other professional also comes to action. So handle it in an ethical and professional way. The third problem comes where we when the team is performing poor from the cricketer and the cricketer who plays also performing poor, then the scenario is quite different where a lot of psychological aspects comes to play. We should know how to tackle it also. Being a physiotherapist, we should be pretty good on tackling those kind of issues also. There are a few times where they lack trust and delegation on giving a job towards you, or you might have a lack of trust on the other supporting staff. So it is very important that you need to trust the other person also who's working along with your team. And the last part comes with the documentation issues where you are handling the player and where you are handing over their documents to the next assigned. So as I said, these ways protocol seems to be very advantageous for handling these kind of issues where you need to share your values and you should be good on communication skills and you need to show good empathetical you need to show good empathy, and most importantly the most important thing is it is very important that you should be approachable also. So it should be I know that these kind of situations are very tough during those times, but you need to get through these challenges, right? When I collected a lot of articles, I come across this article where we have some ways of improving our clinical practicing standards on working with electric teams. So this is what I got from the article. I got two good articles when I searched across. This article clearly shows, one second, please. Okay, 1 second. Okay, this article clearly shows you should be good with your foundation knowledge. Fundamental knowledge is necessary for a sports physiotherapist, so you should be good with the foundation knowledge, and you should be able to address with the critic and synthesis. And you need to collect the information regarding everything, and you need to process the information. And most importantly, you need to have a proper action and intervention. And from there, you need to evaluate and modify also based on the results which you obtain from the action and intervention. And there are few the culture changes across nation to nation, so you need to work according to the specific nation standards, right? On the other side, you can see critical reasoning, flexibility, creativity, independence, and leadership seems to be an essential quality for a sports physio on team handling. So you should have an extensive knowledge and skills that demonstrate, and you should behave in a good way. And what kind of behaviors? It's most about competence-based behaviors that enables or that makes you a better sports physiotherapist, right? This article really clearly shows that you need to build a high performance teams with the latest technology. Now we have moved from a traditional team approach towards building a high performance team. So you can see very clearly in this approach, what they did in this article is they have taken some good outputs from people who work on information technology on team handling, and they take that as an example. People who worked on IT companies, they take their strategies and they implement into the sports science and physiotherapy strategies. And it is very clearly says that you need to have a senior manager, you need to have a coaching group. Senior manager consists of CEO, general manager, all those. The authority is the person for the team, and you need to have a coaching group where it consists of coaching coordinator, director, technical coaches, everything. And you need to have a wellness team which consists of a psychologist or a counselor, and a performance team which consists of nutritionist and strength and conditioning professionals, and then health and medical team where it consists of doctors, physios, nutritionists sometimes, and massage therapists who works along par with us. And you need to have a sports scientist team who has a good set of latest GPS based things. I usually follow Joe Club. Joe Club is an excellent sports scientist from South Africa, where I used to watch all her videos. So she is very keen on making tracking devices, load monitoring tracking devices, and physiology based, exercise physiology based, biomechanical based, and skill acquisition scientist based people should be there on that team, on the scientist team. So this is what research says, in which part we can make betterment. When it comes to teamwork, it's all about leadership roles, and it's all about your performance goals and feedback. And most importantly, you should have a good supportive behavior and team-oriented adaptability. You should have a positive teamwork, and when it comes to positive teamwork, you will have a positive performance, which has better leadership communication things happening around the team. You will have a transformation and charismatic leadership. You should have a good transformation and charismatic leadership. You should learn through feedbacks and positive reinforcement. And with the behavioral aspect, you should be strong with the group identity, and you should have a team structure and cohesion. And most importantly, you should have a structured communication. And with the team orientation and adaptability, with the positive aspect, you should have a knowledge sharing and creation, functional diversity, and a team cohesion. There are a few times where we'll have a negative performance with the team, where these are the parts where we'll feel down with the teamwork approach. It's all about we need to mingle with the team and we need to convert that environment into the positive ones. That's the key for a physiotherapist to work on this specific sport. So you need to have a stickiness on hierarchy with the leadership, and you have a centralization issue. With the feedback, you will have a poor understanding about the feedback, and you will also take the negative feedback. And with the supportive behavior, every time it will end up with a relationship conflict. And with the team orientation and adaptability, you can see you will have a high self-efficacy issues, and along with the asymmetric role perceptions, you will have a very poor symmetrical role perceptions, and you will have a very poor team culture. So it is very important you should have a good positive team environment. When it comes to individual, you need to convert into 4 departments, which is coaching department, science department, medicine department, and the performance department. So ensure that if you're working as an individual, we need to do as a cross referral. And as I said it is highly essential for a sports medicine physician and also the sports physiotherapist to act as a case manager. You should take the responsibility from the starting of the injury time till he is returning back to play. You should act as a single case manager where you can put the referral across to multiple professionals, right? So the summary of my presentation, it is very clear that you need to manage cricket specific injuries, and it is a continuous process. It is a never-ending process. It is continuous in nature, and you need to be plan ahead, and you need to prepare for the season assignment. So preparation before the season is the key here. You need to plan ahead accordingly. And most important thing, there are several different situations you need to get on. So you need to act accordingly, and you need to be so efficient based on working on the situation basis. And you need to be a part of the support staff team. Convert the neutral and negative teamwork culture into the positive teamwork culture. That's the important key here, right? So these are the references which I've taken all together. And thank you all. Thank you, my Rehab Academy team, Saurav sir, Sumanjit sir, all you guys are wonderful. Craig, thank you for the opportunity provided. So over to you, sir.
Thank you so much, sir, for your brilliant presentation. You have summarized a big chapter in a very very nice way and very yeah, very I can say very clear manner too. So participants, you can ask your questions if you have any. So there is a question on from my group. One of the participants has asked whether like this is applicable to only cricket, or like according to the game we need to manage. Like suppose somebody is for football or for some athletic activities, like how we can modify. I mean, obviously it's a little away from the normal this one, but still, if you can clarify.
So I'm very gifted to work with multiple sports. So not only with cricket, I work with multiple sports. So yes, you need to know the sport first, and you need to know the basic requirement. Then you need to do a surveillance about how much percentage of injury happened on that specific sport, and you need to plan accordingly. That's the key here. So the key point here is you get to know about the sport, do a research on how much percentage of injury happening to that specific sport. From there, you can plan accordingly. Right.
Thank you so much. Thank you so much for your reply as well as the wonderful presentation. Over to Craig, sir. I think he's like, now we are at the end of the program. Yeah, over to Craig, sir. Craig Smith, sir, kindly.
Yes, hi guys. Thank you very much, Alagapan, for your presentation. I'm just going to change earpieces.
Thank you. Thank you, sir.
Thank you to Mariab Academy and to all of the presenters. You can hear me, Saurav?
Yes, sir. Please go ahead. Please go ahead.
Okay, great. Okay, great. Some excellent presentations today and this afternoon. Really so grateful to all the participants for joining in, and great turnout. We didn't think it was fair to ask all the presenters to come back at the end of the econ because the Kiwis and the Aussies are fast asleep. I know that Jackie had something to get on to this afternoon. I know Megan was also busy, and she crammed in her her presentation in the middle of a busy afternoon with her kids and her family and that. So we don't have all the speakers here to go through any questions. I know Craig is still here and Alagapan is still here. If anyone has any last questions, we're happy to direct them to Craig and Alagapan. Otherwise, I just want to say in conclusion, and just a little bit of housekeeping to finish up. The recording is going to be shared with all the participants tomorrow. This is an 8-hour meeting, so it'll take quite a while for Zoom to process the recording and then to put it onto the cloud. And Mariab Academy will send me a copy of the recording, and I will send that out to all of our Club Physio participants. And that'll probably come to you Monday morning. Then certificates will be emailed out during the week. I want to remind all the South African packs, those of you who have PT numbers, to please update your HPC number on the website, but also send a copy to me via email. If you've done that already, please do not send it again because I've already captured that. I don't want to have to capture that twice. I don't know if it'll be a problem with the HPC, but I just want a single copy of your PT number. So thank you to those of you who have done that already. International packs, you will get your certificate with 8 CPD hours on your certificate. So it's slightly different to the South African packs. And then we will ask all the presenters to share a PDF of their slides with us. And once that comes in, I'll send that out to you guys. So you'll have a copy of the recording to watch at your leisure. Saurav, Sumanjit, how long will that recording be available on the Zoom cloud? Can you give me an idea?
Yeah, like around 2 days, maximum 2 days, I believe. It should be ready. I mean, complete raw recording should be ready. Yeah.
Yeah, it should be ready by tomorrow morning. But how long will it stay on the cloud? Because we can set a limit to. Normally, we can set a date, or we can set a number of weeks or something.
So by tomorrow it will be done.
Yeah, it'll be on the cloud tomorrow. Yeah, and then it'll be there for a week because I know there is often a time period that it.
No, sir. This will be in the Google Drive, so it will be in our this one only.
Yeah. Okay. So we'll make a copy to Google Drive. Okay, great.
But that Zoom, whatever the Zoom recording, you can get it within half an hour only.
Yeah.
Once it gets settled, like we can actually send it and
we'll share immediately once that is live.
Yeah. Okay, good. Any last questions from anyone? Nice to see so many regular people and some new people. Celia, nice to see you, and Celia and Lazan and Sean and Robin and Anka, and some new people, especially the Indians who've joined us. Don't want to I don't want to miss anyone out, but just Luan, nice to have you on board, and Luan, haven't seen you for a long time, but nice to see you, and Terry Ann and Anne from Ireland, and Yanni, and yeah, so great to have such great support. Chazelle and Nicholas. Nirvana, I think you are new. I think this might be the first event that you've joined us with online, so great to have you with us, and all the rest. Sumanjit, Saurabh, I think we can end it here.
Yes, sir. Thank
sorry,
you so
one,
much
yeah,
to thank you so much to
one
you
last
and
thing.
Suman sir, who actually thought this idea and made it a big success. And like
Sure
being
thing.
the percent which is 110, 115 plus, that to continued for 8 hours together shows that the kind of intricacy they had, the kind of interest with our event, and they actually continued with the same number. Thank you so much to you.
Yeah.
And then of
Thanks a lot, sir.
course, Suman sir, all
Thanks for the show.
Club Physio team, all the
Pleasure.
speakers, and all the wonderful
Pleasure.
speakers, in fact, I could say, and all the participants. My best wishes to all of you. Thank you so much.
Thank you, Saurav. Thank you, Saurav. I just wanted to share an apology from Dave, who was unable to come back and join us. He's had technology issues today, but I'm going to ask him for the PDF of his slideshow. It was getting super interesting. Me being a golfer, I always like to see how the golf mechanics works with the body and where I go wrong when I slice it or I hook it. So I want to see his recording. And then there's also an apology from Raymond Perron, who was supposed to speak on long COVID in the sporting population. As I told you earlier, his travel home yesterday was delayed by 24 hours, so he hasn't made it home. And I just think that if we were to play his recording now, it would just make the day a bit too long. So I will send a copy of that recording out to everyone as well, and you'll be able to watch that at your leisure too. Okay, I think that's it. Okay, guys. Sumanjit, you can close the meeting. Thank you to everyone. Go
Thank
well.
you,
Have
sir.
a great week.
Thanks,
Yeah,
Chris.
you can log off. You can say goodbye. We'll see you again sometime. All the best and thanks so much. I'll be going now. Thanks, Sarah. We'll talk tomorrow. Sumanjit, we'll talk tomorrow.
Sure.
Okay, cool. All right. Thank you. Cheerio. Bye.
Namaste.